I'm going to walk you through some very specific reasons why we exist as a company. And the first one is this, and kind of paint a little bit of a picture here for you that this is all represents your new patient experience and how it also leads into your existing patient experience, because once they become a patient of yours, you still have to keep that VIP experience going. Now, each one of these things that you're seeing come up on the screen as we go here represents a situation where it all leads to the next, okay? Starting with your digital presence, that begins your new patient experience. It doesn't begin once they show up to your door. It begins with the uniqueness of what you do on your digital presence, which is more important than ever before, then all of your competition, all right? From there, the phone call rings and the receptionist has to be great because you're in competition with the other receptionist that they may call. So each one of these steps is leading to the next, okay? It leads to what we call the downtime, what happens between the time you schedule the patient and they actually show up, to your new patient experience once they actually physically walk through the door. That leads on to your exam room flow, doctor exam, iTero scan, a lot of other things as well, how well the assistants handle the x-ray process, etc. Now that leads to your financial presentation. Now depending on how that financial presentation goes, really two things happen. Either the treatment is accepted or the treatment is not accepted. Now let's look at what happens when it is accepted. Now that is, or should, lead to patient referrals, testimonials, things like that, all right? And that's how all of these things lead into the next, all right? Now when it's accepted, that also leads them into them being an existing patient, all right? And that's how those two are intertwined. Now, let's look up here where the treatment might not be accepted, all right? And that leads into your treatment outstanding, your pending treatment. How do you follow up with patients? And again, all of this is your patient experience, the words you use, the systems you have, the culture you have internally, and everything goes into how your employees and your patients feel as it relates to that experience, all right? Now, if you follow up with treatment properly, you're gonna close them at that time. So maybe they say, well, I can't buy from you today, let me think about it. Well, how are you following up with them? And if you're doing it right, that's gonna lead to that treatment being accepted, which in turn leads into your existing patient experience. Now, the beauty of this and why it all starts with the digital presence is you can see how all of this relates back to the digital, because anytime you get a patient referral in today's day and age, that referral is going to go to your website, your social media platforms, other forms of digital presence that you have. And that's why it has to really capture them in order to start the whole process over with the phone call, etc. So this is one of the biggest reasons we exist as a company, because we attack every angle within the practice environment to make sure each one of these steps is operating at its highest levels. Now, competition is another reason why we exist as a company, all right? Dr. Howard Fraun was on our podcast relatively recently. He made a comment that there's one practice per 1,850 people, all right? And I got to thinking about that because I related back to the dental economics study that says only half the country visits a dentist. Now, specialties out there, orthodontics, others, this study pertains to you. So that 1,850 practices, and then you get to the only fact that half the country even visits a practice, you're all the way down to one practice per 925 people. And that competition's growing every single day. And one of the reasons why we exist to solve some of the problems that competition comes with for a business. Now, competition may be something different than you're thinking. Obviously, it's a practice down the street, no doubt about it. But it's also any of these companies that consumers can choose to spend their disposable income on that maybe create a better brand than your practice does, that remains on the consumer mind more often than your practice does. Because this is a situation, this is what your patients, and I can't overstate this enough, is this is what your patients are thinking all the time. Is it, do I buy the clear aligner therapy that you're prescribing me? Or do I spend $4,000 on a flat screen TV? Or maybe this family vacation? This is always going through their mind. And why competition is actually a very good thing if you set your business up right. But you have to articulate more value on what you do than where else they can spend that disposable income. The other reason we exist is the direct-to-consumer. It's really changing a lot of things. You're all familiar with Smile Direct Club. They're changing the industry for a lot of different reasons that a lot of people don't like. But the facts are they're changing the industry, and people are buying from them. They're over a $5 billion evaluated company now, and it shows that people want the unique experience they offer, okay? Virtual consultations, the industry is headed towards that more and more. It's what people want. Gen Z, millennials, things like that, we'll get into a little bit more, that we specialize in as a company. And really all this leads to the changing consumer, because it's very different now, different than it's ever been before, because they buy differently. They expect different things from your digital presence to how your employees are trained. They expect an experience that's different than what a lot of healthcare practices are trained to provide. Not a criticism, but it's just reality. And to prove this, a recent Harris Interactive study shows that almost 90% of people surveyed, this was in healthcare and out, almost 90% of people said that they would choose and remain with a business because of the quality of their customer service, the quality of their uniqueness of the experience over the quality of whatever services they actually were, the clinical results, the food, whatever it may be. And that's why the Direct to Smile or Smile Direct Club, that is the reason why it is changing the consumer, because people are buying from them even though they offer a subpar clinical experience, clinical results. And the reality of the situation, all that goes into the fact that the better CEO is now defeating the better clinician. And I realize in a perfect world that wouldn't be the case, but right now the better business is crushing the better clinician or the better practice. And that is why we believe you can be both, all right? Now let's take a quick look at what customer service is. We talked about people choosing that over the quality of the results, but it's a misunderstood term. It's something that we teach heavily with everything we do. And it's when your business receives what it wants from its respective clientele. Meanwhile, that respective clientele, obviously in this case your patients, get more than they expected, not what they expected, more than they expected out of your practice. It's very important to understand that term. Now, the other reason we exist is the outdated consultant model, all right? We all know what the come and go consultant model looks like. They show up for 6 months, maybe it's 3 months, maybe you fly somewhere, whatever it might be. A lot of them give you some pretty good ideas. It's not that their ideas are bad. Some of them maybe, but whether the idea is good or not, you have to implement it. And one of the reasons why we exist is to become a little bit more of a partnership, a division of your practice that constantly provides those ongoing growth strategies via all the other steps of the appointment process that I was showing you, instead of somebody that comes in and goes. And that helps drive real results, as opposed to you rushing to try to implement 1,000 things in 3 months, and then we all know what happens when that consultant's gone. It all goes right back to how it was before. The other one is, you've all flown to an event. You may take somebody to a training facility of somebody, maybe you go to a weekend event, whatever it might be, then you get back to the practice, and now what? And that's something that we want to set your organization up for success, that when you get ideas from other people, not just us, maybe you get some great ideas at a weekend event. We want to make sure that we set you up in a way that when you get back, you actually can implement those at far higher levels than other people that were at the event. Stuff that's very important to obviously move the needle for your practice. The other one is expertise, and this is not a criticism of other consultants, but for a long time, doctors have sought the advice of other doctors to help grow their practice. Or maybe somebody that turned from an assistant, as an example, inside a practice into a consultant. We come with expertise on the entrepreneur side, the consumer side. We are consumer psychology experts. We know how to apply that psychology to give the consumer a fabulous experience. We're entrepreneurs at heart. We have a passion for helping other people, sales fundamentals, things like that, customer service that we've talked about. The commercial side of your organization that really makes up 80+% of everything that goes on in and out of your practice on any given day, that's what we are experts in. So the expertise comes from a different side of things than somebody that's been within the practice environment, all right? Now, the other piece to all of this is because the better CEO is now defeating the better clinician. And look, I have the utmost respect for your clinical abilities. It's definitely something that I don't have, and we know you've got that handled, all right? But there has never been a time in history in healthcare where you becoming and merging that great entrepreneur, that great CEO, that great business person, great management style in with that clinical piece has never been so important. And that is what New Patient Group does, is handle it, because we want to change the same old thinking that has happened in healthcare for many years that really produces the same results. And we all know, ask Blockbuster how that worked out for them, as Netflix went to them with their idea and they said, no thanks. And we all know the rest is history.